Thank you for the platform. I'm looking to see, hi Amelia, I'm looking to see if the slides are going to come up. Okay, so thank you all. As was mentioned just now, we're actually at the very start of the outbreak. We were fortunate to have a little bit of time to get ourselves prepared because our first case wasn't confirmed until the 31st of March. But we had begun working in February and we had published a city plan on the 20th of March. In terms of informality, Freetown, like most of your cities, has various levels of informality. The three key ones being the informal settlements, informal transport, and informal employment. And from the perspective of all of these, it makes the key preventative measures of COVID very difficult. We only have 47% of our population in these informal settlements and citywide with access to running water. If your main mode of transport is an Okada, a motorbike, where you're holding the person in front of you, the driver, social distancing is a myth. So our plan has been around how do we address those, and I'm happy, it's on our website, but obviously happy to share it into this forum for easier dissemination. So the COVID plan that we designed, aligning with national government, although this has been, you know, the point that Emilia made, this has really been a point of some coordination challenge, shall I say, in terms of us having a plan, but really being starved of information and starved of resources. With regards to the informal settlements, the approach that we've taken has been threefold. There are three strategic elements to our plan. Number one, behavior change messaging, the front line of the response, making sure we get the message out. And this is really building from the lessons we learned from Ebola, of which there were 4. Command and control, clear reporting lines, clear management structures, clear information flows. Now, that was the first. The second one, community ownership, at the heart of our response plan. Making sure the community own this, whether they're informal settlements or not. Third, closing the gap between reality and protocol and practice. And fourth, isolate, track, and contain the virus. So our plan is challenged. It has 3 elements. So those were the lessons, the context from Ebola. The plan itself has 3 elements, very quickly. Behavior change messaging, speaking to the people in a manner which they understand. So community ownership is key. We've set up community outreach teams, which move across the city in every ward. But then that's going at a horizontal. Then at a vertical, we have sector and special interest specific community groups. So persons with disability, Ebola survivors, the Slum Dwellers Association, the commercial drivers unions, the Interreligious Community Council. So we work with them to target their special interest groups whilst working across the city with the councillors to reach every community. But the challenge comes also from the lack of devolution of urban planning and access to land when it comes to simple things like social distancing and wanting to be able to spread out. But in all that we're doing in our plan, of which the first is behavior change messaging, the second is behavior change support. If I tell you wash your hands and you have no water, how do you do that? So we're investing a lot on providing water supply into our communities, but building resilience. So not just bringing tanks and bowsers, but also using this opportunity to put in place rainwater harvesting systems. Streams, how can existing streams be treated so it can be a sustainable solution? We're working with providing community kitchens, the lockdowns the government sets up, but we're also introducing urban farms into our slum communities so that we have that resilience being built. And lastly, if we look at learning from the crisis, I think a message that's coming across to everyone, existing vulnerabilities are heightened by the crisis. If you didn't have water before the crisis, you know now how important it was to have water. If your communities, and we have long-term plans, medium-term plans already for slum upgrades, for informal settlement upgrades, and relocations, but they become a greater priority. So a key lesson would be investing in the future before you need to. Gender mainstreaming is part of how we're doing the response, but it's also part of our interventions. The community outreach teams I described have to be 50% women, but we also have interventions such as supporting the Women's Center, because we know there'll be an increase in gender-based violence. So we're actually putting money aside to ensure that they can cope, whilst making sure our messaging speaks to these issues. And finally, I would say, in terms of this outbreak and how we're looking at things, there's no option but to take risks. We are financially constrained, but we need to make big decisions, such as waiving the issuing of property rate notices to our least, the least economically strong to our most vulnerable, and doing it in such a way that we hope will not result in other members of society saying, well, if they're not paying, we're not paying. So it's a question of taking risks. But we are early. We have today 104 cases, and we know that the numbers will increase, particularly in our informal settlements. But we've got our plan ready. At the heart of success is community ownership and them actually stopping the transmission. Thank you.